could you do this? How could you?
If you don't feel anything while reading that, check yourself. You're sick and you need help. My name is Sarah Adila and I'm here to talk about mental health. The conversation in the beginning of this video is just a small piece of what happened to those who suffer from mental illness. Even though it is just made for this video, truthfully, it hurts. Ladies and gentlemen, brothers and sisters out there, these people who try to run, not all of them are attention seekers. They just need help. They need someone to talk to. So, if you have time, lend them your ear, hear to their problems, and encourage them to get help. But if you can't say any good words, then don't say anything. Even the smallest gesture can affect their mental health. It might worsen their condition and make it hard to recover. Okay, let's go deeper into this topic. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. There are some factors leading to mental health problems. There are biological factors, which includes genes and brain chemistry, life experiences, be it due to trauma or abuse, and family history of mental health problem. Mental health problems are actually very common. According to World Health Organization statistic in 2019, around 1 out of 5 people have mental health disorder. Around half of the patients experience symptoms before they reach 14. Approximately 76% and 85% of people from low and middle income countries doesn't receive any mental health treatment. If you're wondering why these people refuse to get their treatment, here is the answer. First, stigma. Many people are afraid of being stigmatized if they admit that they need help. This is because society in general has stereotyped view that people with mental health illness are violent and dangerous, when in fact, they are vulnerable and have higher risk to harm themselves. Second, they are in denial. They know that they're having symptoms, they're having problems, but they come up with the decision to not seeking for help. Lastly, their condition make it hard. Yes, it is almost impossible for you to drive yourself to the hospital when you're having a bad flu. Same goes to those with mental illness. It can make it extremely hard to seek for treatment on your own. So, how can we help them? Give them support. As a family and friend, as I said before, lend your ears and hear to their problem. If their condition is bad, be with them. Ask for their condition routinely and bring them to the therapist. Help them getting their treatment and remind them to take their medication accordingly. Mental health is not a failure. If there is a failure, it is to be found in the way of we respond to people with mental illness. You don't have to struggle in silence. Contact the hotlines here to seek for help and emotional support. You don't have to wait until your depression and problem becomes worse. Help yourself now. It is okay to not be okay, but it's not okay to give up. Spread this mental health awareness and stop being judgmental.